Hello and welcome. Today's topic is thyroidectomy, or the surgical removal of the thyroid gland. We'll learn what the thyroid gland is, where it's located, what its functions are, and we'll watch how it's removed, either through conventional surgery or using an endoscope. We'll also cover the possible complications after the operation. But before we begin, make sure to like this video and subscribe to the channel so that others can benefit too. The thyroid gland is located directly in front of the trachea, just below the larynx. It has a butterfly shape wrapping around the trachea on both the right and left sides. Although small in size, it produces hormones that affect the function of every cell in the body. The main hormones it secretes are T3, triiodothyronine, and T4, thyroxine. These hormones give cells instructions on how to consume oxygen and nutrients, a process commonly known as metabolism, or burning calories, which allows cells to generate energy for the body to move and perform its activities. This energy also produces heat, which helps maintain body temperature in cold conditions. Some people think that wearing heavy clothing is enough, but in reality, the warmth you feel comes from your body, not the clothes. Clothing simply helps retain heat and reduces heat loss to the environment. Without a functioning thyroid, the body would struggle to maintain warmth even during summer months. There are 4 common reasons for thyroidectomy. 1. Thyroid cancer. 2. Thyroid nodules, benign tumors that are not cancerous. 3. Goiter, an enlarged thyroid that can compress the trachea, causing difficulty breathing. 4th, hyperthyroidism, overactive thyroid producing excessive hormones, which can harm the body. Other medical conditions may also require thyroid removal. During the surgery, the patient is placed under general anesthesia. The thyroid can be removed either through open surgery or endoscopic surgery. In open surgery, the surgeon makes a small horizontal incision in the neck to access the thyroid. In endoscopic surgery, the surgeon makes an incision inside the lower lip and 2 smaller side incisions to insert the surgical instruments. A port is inserted through the central incision, and the endoscope, equipped with a camera and light, allows the surgeon to see the operation on a screen. The surgeon carefully dissects the outer layers to reach the thyroid. Whether open or endoscopic, the gland is first divided into 2 parts for easier removal. The blood vessels supplying the thyroid are then cauterized to prevent bleeding. The gland is placed into a sterile surgical bag and removed. The second part of the thyroid is removed in the same way. Once the thyroid is fully removed, the surgeon closes all layers, removes the endoscope and instruments, and finally closes the incisions in the mouth or neck. If open surgery was performed, a drain may be placed to collect blood or fluids, which is usually removed after 48 hours, and the wound is covered with a sterile dressing. Possible complications include injury to the recurrent laryngeal nerve, which controls the vocal cords. If damaged, the patient may experience hoarseness or difficulty speaking, which can be permanent. Parathyroid gland injury. These are 4 tiny glands, the size of lentils, located behind the thyroid, which regulate calcium levels in the body. Sometimes they are removed along with the thyroid. After surgery, the patient usually stays in the hospital for 1 to 2 days. They are prescribed levothyroxine, a hormone replacement therapy, and calcium supplements to compensate for parathyroid removal. This treatment is lifelong. The cost of thyroidectomy in Egypt ranges from $300 to $800, depending on the patient's condition and the hospital. That concludes today's video. If you found it helpful, don't forget to like and subscribe for more educational content. Thank you for watching, and goodbye.